Good afternoon. My name is Gina Van Halbeck, and I'm the reading specialist for the Clotis School District. Today I will be doing a professional development video on assessments. The first assessment that I will be talking about is reading assessments. Reading assessments help to identify a student's ability in the area of reading. Reading assessments should focus on one of 5 main areas: phonological awareness, phonics decoding, vocabulary, reading fluency, or reading comprehension. You will probably focus on these areas differently depending on what grade level you teach. Reading assessment of students can be collected in a variety of ways through screening, diagnostic, formative, or summative assessments. The goal is to get a deeper understanding of students' strengths and weaknesses. One tool that can be used as a reading assessment are the Journey's independent reading pages in their reader's notebook. These pages can help teachers understand if students comprehend the text and gives a sample of their writing. Using reading assessments in a variety of ways can help teachers understand if students need remediation and can help students with any misconceptions or if there is a pattern that they may need to be referred to the intervention support. The reading specialist's role is to review any assessments for students who may be below grade level, as well as administer additional assessments to know if they qualify for interventions and in what areas. Students are active with understanding reading assessments as they are able to understand where they are at their reading. The assessments can be used to have students graph their scores on formative assessments and can help track their own progress throughout the year. The next assessment I will be talking about are language assessments. Language assessments help identify a student's ability, use, and understanding of language. Language assessments focus on reading, writing, speaking, and listening. These assessments can be used to determine how English and ELL students are progressing and meeting milestones in the area of language. These assessments can be collected using formal tests, checklists, inventories, self-assessments, and writing folders. One reliable tool teachers can use are students' writing folders. By looking at a student's writing folders, you can understand their thoughts, conventions, syntax, sentence structure, grammar, etc. These writing folders can help teachers set up small groups, help students fix misconceptions such as their use of there, and there, or verbs, nouns, which will help for remediation. Teachers can also use this data to share with the reading specialists to help in intervention groups and further teach concepts such as sentence structure and wording. Reading specialists use language assessments to guide their intervention and to help indicate which students need further assessment or referrals to speech therapists. Language assessments are a part of the student's learning process because they can interact with their writing folders to see where they are making errors, correct their mistakes, and help identify errors in peer writing. The third test I would like to talk about is diagnostic testing. Diagnostic testing is formal testing. Diagnostic tests are usually given when a student is identified to be one or more grade levels below their current grade level. Diagnostic tests measure specific standards and assess for strengths and weaknesses. Reading diagnostic tests look at visual and auditory discrimination, phonetics, blending, word recognition, vocabulary, comprehension, and more. In our districts, IXL is a diagnostic test in reading and is given by the reading specialist. When a student is identified below grade level, the reading specialist will have the student take the IXL diagnostic test for 30+ minutes to determine the area of strength and weakness. A printout will be given to the teacher and they will use the assessment to determine intervention needs. Skills that are not below grade level will still need worked on and may be given through remediation in the classroom. Students are given an explanation of the diagnostic tests and given encouragement to do their best so that we can help them become better students than they already are. Going over testing with students encourages them by providing them with examples of their strengths and weaknesses. This helps them understand they have strengths and does not just focus on their weaknesses. Another area that I will be talking about is remediation. Remediation is usually done within the classroom and is used to help students who are having difficulty with a concept but are not below enough to need intervention. Remediation in reading and writing may focus on one concept, such as setting up paragraphs, grammar, or punctuation errors. One activity that can be used as a remediation activity is expanding sentences. When students continually show short, choppy sentences in their writing, a teacher can create a small group to show how to stretch sentences. Using an anchor chart, the teacher can show different ways to stretch a sentence. I like to also use a Slinky as part of this to show how you can make sentences longer. I then have students write a short piece practicing stretching sentences. When they're done, the students can use the Slinky to show if they have stretched a sentence. The Slinky won't move if there is 5 or less words in a sentence. The Slinky moves halfway if there is 6 to 10 words, and all the way if there's 11 or plus words. The reading specialist can help lead remediation groups in the classroom, or they can give teachers ideas on how to progress students to understanding if a teacher is struggling with ideas. Students have an understanding that remediation groups help them to understand concepts better by getting more practice and are done in the classroom. These hands-on lessons help students understand concepts in a different way. Next, we'll be talking about intervention. When do students need intervention? Intervention is when students are identified to be struggling and are below grade level. Students usually receive interventions outside of the classroom. When students are below in reading and writing steps are designed to help students receive reading and writing strategies to progress towards grade level. In these steps, they include detailed tracking and adjusting of intervention to help them achieve the goals set. In our district, students who need intervention receive Title I intervention. Within Title I, all students are screened using the program's screening tool. When a student is identified at risk, they begin services with the reading specialists. These services can be pull-in or pull-out. In our district, they are mainly pull-out services. When students need services, they are given an explanation of where they are struggling and work on tracking their progress towards meeting their goal. The last thing I want to talk about is progress monitoring. Progress monitoring is used to track students' academic performance, to show their rate of improvement and progress towards set goals, as well as how they are responding to instruction. Progress monitoring can be done individually or as a whole class. In our district, we use STAR Reading to track students' reading progress. As a teacher, you administer the STAR assessment 5 times during the year: at the beginning, before each report card, and at the end of the year. STAR Reading shows the progress students are making over the course of the year and identifies students, if they are above, below, at risk, or need interventions. The reading specialist is given a copy of the scores. This helps the specialist to determine if their interventions are working for certain students or helps to identify students who may be at risk or need more intervention. Students use the intervention from the test to understand their progress. I usually have students track their progress on a graph, and we set goals based on the progress reports.